Hello guys, welcome back to my channel Pharma Learning with Deepika. I hope you all are doing great. So without wasting your time, let's start a new video on parts of prescription from the chapter prescribed medication order. For my previous videos on prescribed medication order, you can check the link in the description box. You can click on the I button also. Let's talk about the parts of prescription. So basically the parts of prescription include the prescriber information, patient information, date of prescription, superscription, inscription, subscription, then the direction to patient, that is called as the transcription, and the signature of the prescriber. So what is prescriber information? So prescriber information may include the name of the prescriber, qualification of the prescriber, then his practice number, address of the prescriber. Then in patient information, the name, address, age, weight of the patient in the case of prescription, then the name and address of the person to whom the medicines are delivered in the case of prescription issued by a veterinarian. Then date of prescription, you have to mention on which date the prescription is issued or the prescription order is issued. Then in the superscription, it include RX. So RX in an abbreviations of the Latin word recipe, which means to take or take though. So the symbol is said to designate Jupiter. The Jupiter is a god of healing. The next is the inscription. So it is the main part of the prescription. So basically it contains the name and the quantity of the prescribed ingredient. Then it also contains the manner in which the medicine should be taken. Then next is the superscription. So next is the subscription. So in subscription, basically this is a part contain the prescriber directions to the pharmacist. So it include the type of doses form to be prepared, the number of dose to be dispensed. So next is the transcription, that is direction to the patient. So transcription is the prescriber directions to the patient, contain the instruction about the amount of drug, time and the frequency of doses to be taken. Then last is the signature of the prescriber. So prescription must be signed with prescriber's own hand. Address and registration number should be written in case of the dangerous drug. Then how you will handle the prescription? So handling of prescriptions can be done by receiving the prescription. Then you have to calculate the dose. Then you have to do the compounding of that particular prescription. Then finishing, pricing and delivering. So these are the basic points which include in the handling of the prescription. So receiving of the prescription means pharmacist should himself receive the prescription. So it include the reading of the prescription and checking of the prescription. The two things are there, reading of the prescription and checking of the prescription in the receiving of the prescription. So reading of the prescription means prescription should be completely and carefully read from top to bottom. Then checking of the prescription means prescription should be checked for any incompatibility. Incompatibility means like if the prescription is prescription containing RX, acetyl salicylic acid, then codeine, then amodiaprine. So acetyl salicylic acid interferes the narcotic action of the codeine. So this combination is questionable. So pharmacist has to check the incompatibility between the between the different doses form. Then dose calculation. So next is a dose calculation. So dose can be calculated as the child dose from is calculated with the help of Young's rule. So Young's rule, in which you will calculate the child dose by calculating it with the age plus multiply by adult dose divided by age plus 12. So this is the formula to calculate the child dose. Then Frye's rule. in which you calculate the child dose when the age of the child is in the month. So age in month divided by 150 into adult dose. So this is how you will calculate the dose. The next point is the compounding. So the ingredients are compounded by accurate method. For weighing, electrical machine should be used. Then next is the finishing of the prescription. So finishing may include the packaging, labeling, rechecking, recovering, rechecking and the recording of that prescription. So basically packaging include after compounding of the packaging of the prescriptions can be done. So for packaging, following containers are to be used. So it depends what kind of dose or dosage form you have to pack. So round vials, oval bottles, wide mouth bottles, colored bottles, collapsible tubes, paper wrapper, dropper bottles. Then you have to do the labeling. So for labeling, the filled container should be suitably labeled and the label should be affixed on a smooth surface of the bottle. Then rechecking is done. So you have to recheck the prescription. So each prescription should be rechecked carefully. Then after labeling the container should be thoroughly polished to remove the fingerprints. Then you have to record the particular prescription into your available file. So which serves to maintain and preserve the original prescription in the numerical order. Then you have to do the pricing of that prescription. So the prescription should be priced immediately after receiving it and inform the patient about it. So this should be done before starting the compounding to avoid any dispute. Then delivering of that particular prescription is done at last. Now next is the interpretation of the prescribed medication order. So interpretation of the prescribed medication order means the drug use is a complex process and there are many drugs related challenges at various levels. So involving prescriber, pharmacist and the patient. While medication misadventures can occur anywhere in the healthcare system, from prescriber to dispenser to administration and finally to patient use. So simple truth is that many errors are preventable and pharmacists assume active role in appropriate use of the drugs. So you have to interpret the prescribed medication order. तो क्या होता है कि जो मेडिकेशन ऑर्डर रहता है उसमें ऐसे टर्मिनोलॉजीज या ऐसे टर्म्स लिखे होते हैं या ऐसे एब्रिविएशंस लिखे होते हैं जिसको समझना एक पेशेंट के लिए बहुत ही मुश्किल होता है. सो फार्मासिस्ट इसमें एक अच्छा रोल प्ले करता है कि वो क्योंकि उसको उन वर्ड्स से का मीनिंग क्या होता है, वो एब्रिविएशंस किसके लिए यूज़ किए गए हैं तो उसको बहुत अच्छी तरीके से पता होता है और ड्रग का क्या यूज़ है वो भी उसको पता होता है. तो वो पेशेंट को अच्छी तरीके से गाइड कर सकता है, उसको काउंसिल कर सकता है. सो व्हाट इज़ द ऑब्जेक्टिव ऑफ द इंटरप्रिटेशन ऑफ द प्रिस्क्राइब मेडिकेशन ऑर्डर? दैट डेमोस्ट्रेट एन अंडरस्टैंडिंग ऑफ द फॉर्मेट एंड कंपाउंड ऑफ अ टिपिकल प्रिस्क्रिप्शन. सो जो भी टिपिकल प्रिस्क्रिप्शन रहता है उसके फॉर्मेट को अपन अंडरस्टैंड कर सके, कंपोनेंट जो टिपिकल प्रिस्क्रिप्शन हैं उसके फॉर्मेट को अंडरस्टैंड कर सके, तो इसके लिए इंटरप्रिटेशन करना ज़रूरी होता है. Then demonstrate an understanding of the format and component of the typical institutional medication order. तो जो भी institutional medication order होता है उसके फॉर्मेट को भी अपन अंडरस्टैंड कर सकें. Then आप इंटरप्रेट कर सकते हो करेक्टली स्टैंडर्ड एब्रीविएशंस एंड द सैम्पल यूज्ड ऑन द सैम्बल्स यूज इन द प्रिस्क्रिप्शन एंड द मेडिकेशन ऑर्डर. तो क्या मेडिकेशन ऑर्डर में क्या सैम्बल्स और क्या एब्रीविएशंस यूज़ हो रहे हैं उसको भी आप अच्छी तरीके से डिटरमाइन कर सकते हो. दैन आप इजीली पेशेंट कंप्लायंस और नॉन कंप्लायंस जो है मेडिकेशन उसके बीच में डिफ्रेंशिएट कर सकते हो. देन सप्लाई कैलकुलेशंस टू डिटरमाइन कंप्लायंसी. So these are the basic common Latin abbreviations that may be used in prescription writing. A.C. that is the ante-sebum, it means before the meal. Then admu. That is admu, जिसका मतलब होता है apply. Then alt-h, that is alternis horis, जिसका मतलब होता है every other hours. Then A.M. that is ante-meridiem, जिसका मतलब होता है morning, afternoon. Then bis. So from the Latin word bis, it means twice. Then BID, that is bis and die, twice daily. CC, come kibos, means with food. EMP means exo modo prescripto means as directed. HS means hora somni, that is at bedtime. So there are many abbreviations which are used in the prescription writing. Then second B is the medication error. So the medication error basically it is the मेडिकेशन एरर कैसे आ सकते हैं कि अगर पेशेंट की जो इन्फॉर्मेशन है वो इनकम्प्लीट होगी, नॉट नोइंग अबाउट द पेशेंट एलर्जीज, अदर मेडिकेशन दे आर टेकिंग, प्रीवियस डायग्नोसिस एंड द लैब रिजल्ट्स. तो ये चीज़ें होती है जिसकी वजह से इनकम्प्लीट इन्फॉर्मेशन की वजह से मेडिकेशन एरर आने के चांसेस होते हैं. देन अनअवेलेबल ड्रग इन्फॉर्मेशन सच एज लैक ऑफ अप टू डेट वार्निंग्स, तो उसकी वजह से भी ड्रग के इन्फॉर्मेशन में अनअवेलेबिलिटी आ सकती है. देन मिसकम्युनिकेशन ऑफ द ड्रग ऑर्डर like which can involve the poor handwriting, confusion between the drug with the similar names, misuse of the zeros and decimals point, confusion of the matrix and other dosage unit and inappropriate abbreviations. तो उसकी वजह से miscommunication आ सकता है drug order में. For example, you can see that if it is written 0, 1, 2, if you forget to write point here, so this is the misuse of the zeros like this. If it is written like 12 तो you will आपको लगेगा कि 1200 लिखा है लेकिन ये 12.00 है. तो इस तरीके से मिसकम्युनिकेशन हो सकता है कि प्रॉपरली कभी समझ नहीं पाए, है ना. सिमिलर नेम्स होते हैं बहुत सारी ड्रग के, तो उससे कन्फ्यूजन क्रिएट होता है. डोजिंग यूनिट में जो है यूनिट्स में कभी कभी प्रॉब्लम आ सकती है. Then lack of appropriate labeling. So lack of appropriate labeling is a drug is prepared and repackaging into the smaller unit and environmental factors such as आपका लाइटिंग जो रहता है वो अफेक्ट करता है, हीट, नॉइज़, इंटरप्रिटेशंस, ये सारी चीज़ें जो इंटरप्शंस जो रहते हैं, ये सारी चीज़ें जो रहती है अफेक्ट करती है. तो ये अल्टीमेटली जो हेल्थ प्रोफेशनल है उनको डिस्ट्रैक्ट कर सकती है फ्रॉम देयर मेडिकल टास्क. तो अप्रोप्रिएट लेबलिंग भी ज़रूरी होती है, नहीं तो मेडिकेशन एरर आने के चांसेस होते हैं. देन डिस्पेंसिंग एरर्स आ सकते हैं. तो डिस्पेंसिंग एरर्स में बेसिकली देखा जाता है कि एरर ऑफ रॉन्ग इंटरप्रिटेशन ऑफ द डॉक्टर प्रिस्क्रिप्शन, क्योंकि डॉक्टर्स की हैंडराइटिंग ऐसी होती है कि वो स्पेशली चिल्ड्रंस वगैरह जो रहते हैं वो समझ नहीं पाते हैं. तो प्रिस्क्रिप्शंस की रॉन्ग हैंडलिंग भी एक तरीके से डिस्पेंसिंग का एरर बन सकती है. So dispensing error refers to the medication error linked to the pharmacy and include the error of the commissions like the dispensing the wrong drug or the dose. Then those of the omissions like the failure to counsel a safe use of the medicines. Then most dispensing errors involve the dispensing of an incorrect medication, dosage strength and dosage form, look alike and sound alike drugs often causes the confusion with the innegligible prescriptions or the verbal medications order, and the errors are likely inaccurate calculations of the dose. The next is the causes of errors. So many causes of errors are there. Too many for telephone calls also disturb. This also comes during the prescriptions error. Then overload. Then too many customers are there. Then lack of concentrations. Then no one is available to the double check. Then staff storage. Staff shortage. So that is also a part of error which can be occur. Then similar drug names. Then no time to consult. Then illegal eligible prescriptions. Then misinterpreted prescriptions. So these are the errors which come during the prescription handling. Then common type of medications errors like the Institute of the Safe Medication Practice, that is ISMP, Institute of Safe Medication Practice, identify the following areas potential cause of the medications error, like the poor drug distribution practices. If the practices is not proper, then poor drug distribution take place. Then the working environment is when stressful, then the error occur. Then complex or the poorly designated design technology is there, then error occurs. then access to the drug by non-pharmacy personnel, then non-pharmacy persons cannot अंडरस्टैंड द एब्रीवेशंस प्रॉपरली, सो उससे एरर आने के चांसेस हो सकते हैं. डोज मिसकैलकुलेशंस की वजह से हो सकता है. लैक ऑफ इन्फॉर्मेशंस टू प्रिस्क्राइबर, लैक ऑफ पेशेंट इन्फॉर्मेशन, देन लैक ऑफ पेशेंट अंडरस्टैंडिंग ऑफ their therapy. So these are the basic errors. That's all for today. Thank you for watching. I hope you are liking my videos. If you like my videos, then subscribe to my channel and share my videos as much as you can with your friends and family members. Stay safe and healthy. Bye bye. Take care.